Hello students, welcome to Lazy Tutor where you can learn nursing simply. Today we are going to learn about the structure of pelvis. There are two types of structures in pelvis. One is false pelvis and other is true pelvis. Let's see false pelvis first. So false pelvis is formed by this upper flayed out part, then this iliac fossa laterally and posteriorly sacrum. We have sacrum here. Then so sacrum, especially in sacrum, it is the lumbar vertebrae 5, L5 is posteriorly in sacrum, and anteriorly the abdominal one and equivalent 11. So anteriorly, so above everything anteriorly, the inguinal ligament and abdominal wall are there. So this is false pelvis, and it protects the abdominal organs, and we don't have any obstetrical importance to this false pelvis, except it provides a landmarks for external pelvimetry. So it provides only the landmarks for external pelvimetry for diagnosis of any kind of diseases in pelvis. Okay, next we are going to study about the true pelvis. True pelvis is a bony canal through which fetus passes through the birth. So during birth, through this canal, this bony canal, the fetus pass through. There are three parts are there: brim, inlet, and cavity are there. Brim, inlet, cavity are the three parts of true pelvis. I will show you. This is the brim, and this one is cavity, and outlet is the inferior end portion to it is the outlet. So these are the three parts in true pelvis. Now let's study the brim in detail. So it is formed by sacrum posteriorly. So it is formed by sacrum posteriorly, and laterally the iliac bones. Iliac bones are there, and anteriorly we have symphysis pubis. So these are the different parts which forms the brim, and its shapes is almost rounded with anterior posterior diameter being shortest. So it is rounded, but the anterior posterior diameter is getting low and low, like it's being shortened. Its boundaries have sacral promontory. It has sacral promontory, the wings of sacrum. The sacrum promontory is there, then the wings of sacrum are there, then iliac bones are there, then pubic bones. So these are the boundaries of this brim. Now let's see the landmarks of this true pelvis. So this is the landmarks of true pelvis, which starts from this 1 to 9. I'm starting from here. You can either start it from here also. Now, as the picture suggests, I'm starting from here. So the first number denotes symphysis pubis. It is symphysis pubis. So it starts from symphysis pubis, and from symphysis pubis it is the pubic crust. From 1 to 2 it is pubic crust. Then 2 to 3 is pubic tubercle. Then we can see pectineal line. Then there is a iliopubic eminence are there, iliopubic eminence, and after that iliopectineal line, sacroiliac joint, then the wings of sacrum, which is sacral ala, and the last one is sacral promontory. So these are the landmarks of our true pelvis. So it starts from symphysis pubis, then pubic crust, then pubic tubercle, pectineal line, iliopubic eminence, iliopectineal line, sacroiliac joint, sacral ala, and last is sacral promontory. Now let's see the diameters of brim. So we have three diameters of brim. which are anterior, posterior, transverse, and oblique. These are the three diameters of brim. The first diameter we are going to study now is transverse diameter. It is of 13 centimeter and it extends across the greatest width of brim. So this is the greatest width of brim. And the next diameter is oblique diameter. It is of 12 centimeter and it extends from this iliopectoral eminence to the sacroiliac joint. And the last diameter is anterior posterior diameter. It extends from the sacral promontory, the midpoint of the sacral promontory, to the symphysis pubis. These anterior posterior diameter are of three types, which are diagonal conjugate, obstetrical conjugate, and true conjugate. Now let's see the diagonal conjugate. So it is the distance between the midpoint of this midpoint of sacral promontory to the lower border, which is the lower border of symphysis pubis. And next one is obstetrical conjugate. It is the distance between the midpoint of sacral promontory to the bony. There is a prominent bony projection in the symphysis pubis, in the midline of symphysis pubis. So it goes to the middle area of this, to this bony prominence. And the last one is true conjugate. It extends from the midpoint of sacral promontory to the top of this symphysis pubis. So there are difference in this diameter. So these are the three types of diameter in anterior posterior diameter. Now we are going to study about the pelvic cavity. So pelvic cavity extends from the brim superiorly to the outlet inferiorly, to the outlet, not the symphysis pubis, to the outlet inferiorly. It has three walls are there: anterior wall, posterior wall, and lateral wall. These three walls has 12 centimeter in diameter. So the anterior wall has this pubic bone and symphysis pubis. Anterior wall has pubic bone and symphysis pubis. Then the posterior wall has the curve of sacrum, Then the lateral wall has soft tissues. This is the pelvic cavity. Now moving on to pelvic outlet. So pelvic outlet has anatomical outlet, narrow pelvic strait, and obstetrical outlet. So these three are there in this pelvic outlet. First we are going to see the anatomical outlet. So anatomical outlet consists of the lower border of all the bones in pelvis and the sacrotuberous ligament. So these are there in anatomical outlet, which is the lower border of all the bones and sacrotuberous ligament. Next is the narrow pelvic strait, which are seen in between the sacrococcygeal joint. So the sacrococcygeal joint, ischial spine, and the border of symphysis pubis. These three are there in the narrow pelvic strait. And the next one is the obstetrical outlet. It is a space between the narrow pelvic strait and the anatomical outlet. So this narrow pelvic strait and anatomical outlets in between space are called obstetrical outlet. Now we are moving on to the end of this topic, which is the types of pelvis. So there are 4 types of pelvis, which are gynecoid, anthropoid, android, and platypelloid. So these are the different types of pelvis. It may ask for short notes, to write in short notes or difference between. So first one is the gynecoid pelvis, which is a female pelvis. This is the gynecoid pelvis, which are female pelvis. It is suitable for childbirth. It has a wider brim. Ischial spines are blunt, and subpubic angle is 90 degree. The subpubic angle is 90 degree. And next is the anthropoid one. So anthropoid, This is the anthropoid pelvis. It favors the posterior position of the fetus. If the fetus is in malposition, like is in a posterior position, so it favors this. If the female has anthropoid pelvis, then it favors the posterior position of fetus, and it has an oval shape. The transverse diameter is short. It is seen in women with narrow shoulders. So for women who has narrow shoulder, they definitely have this anthropoid pelvis. And the next is the android pelvis. So android pelvis is the male pelvis. It is heart shaped brim. It has a heart shaped brim. The anterior posterior diameter is shorter because they don't have to do the childbirth. Since this pelvis is not doing that, the anterior posterior diameter is shorter. The transverse diameter is wider, but they have a wider transverse diameter. It is very difficult to do the childbirth since their diameter is like this. And the next is platypeloid. This is the platypeloid pelvis. It is a flat pelvis. It is kidney shaped. It has a kidney shaped brim. The anterior posterior diameter is smaller. Transverse diameter is wider. Not conductive to vaginal delivery. We can't do vaginal delivery if the female has this platypeloid. Now this is a small trick to remember the diameters of every diameters of this female pelvis, which is just mug everything there in the box. It's really easy. The numbers are really easy, like 11, 12, 13, 12, 12, 12, 13, 12, 11. So the brim in anterior posterior is 11, in oblique is 12, and in transverse is 13. So the cavity in anterior posterior is 12, oblique is 12, transverse is 12, and in outlet the anterior posterior is 13, then the oblique is 12, and the transverse is 11. So just mug up everything there in the box, and it will really help you while you write the diameters in true pelvis. So that's all about the structures of pelvis. We have learned there are two types of structures are there: false pelvis and true pelvis. Then in true pelvis there are three parts are there: the brim, which is also called inlet, then cavity and outlet, then the landmarks of this pelvis, then diameters of pelvis, and lastly the types of pelvis. So this was all about the structures of pelvis. Hope you understood my class. Thank you for listening.